So we have two speakers today, two presenters, and one of them is Ellen Rubin. And Ellen Rubin is an independent access consultant working to improve opportunities for people with disabilities. She facilitates programs which encourage individuals with disabilities to enter into their communities as equal members in education, employment, and social life. Ellen is a member of the Greater New York Council of the Blind. Welcome, Ellen.
Good morning. Good morning. I'm glad to be here today. I'm going to talk about the increased opportunities for accessible information about our prescriptions. This, I'm speaking particularly about something called Script Talk. But anyway, a friend of mine called me and told me about this great thing that he had. This is about 3 years ago. And what it does is it provides information, critical information, about health and safety regarding our prescriptions and our medications. The information that it provides includes the following: a list of the prescription name, obviously, the name of the patient, the instructions on how to take it, the quantity of pills that you've received, the prescription date, which I know is important for lots of us, the use-by date, the refills that are available, the prescriber, the pharmacy, name and number. It also gives you information, the phone number, and the prescription number, which I don't know about many of you, but I never had that information. I always used to call up and say, my name, this is the prescription I need, and so having the prescription number is fabulous. And then it gives you warnings. Last time I brought my personal prescriptions, and I am a cancer survivor. I was a little embarrassing, so I brought different prescriptions today. It told me not to be pregnant. Okay, I'm gonna turn it on. It is a sort of semicircle that I will pass around at some point, and actually Kim has one here too, so we will allow you to look at them. I'm turning it on. You'll see it can be quite loud.
Script Talk station ready.
Okay, that tells me it's ready. There are a series of dots on the face of the device. I can put the bottle in the space that's surrounded by dots. The bottle itself has a tag on the bottom. And I will send around bottles too that you can feel the tag on the bottom. Okay, now I'm going to press the button that will start the description of what this does, or what this informs me of.
Patient Ellen Rubin. Medication Metformin HCl 500 milligram tablet. Instructions: take 1 tablet 2 times daily. Quantity 180. Prescription date August 20th, 2014.
It's an old bottle.
Use by February 19th, 2015. Refills remaining. 3. Prescriber Dr. Kenneth Weinstein, New Utrecht Pharmacy. To reorder this prescription, dial area code 718-436-9300. Prescription number 722320. Warning: do not drink alcoholic beverages when taking this medication.
I become a teetotaler.
Taken food. Warning: severe or prolonged vomiting or diarrhea may cause dehydration.
We don't have to hear about this. But one of the things that's actually quite lovely here is the fact that you push a button when the machine beeps to access the information. But you can also, and I'm going to go back.
Warning. Warning. Warning.
Whoops.
Warning. Warning. Warning.
Oh dear.
This medication
It doesn't want to go
will
back.
cause an
Maybe it's up. No, up and down, yeah.
Warning. For more info, enter code 70. For more warning. Warning. Warning.
Well, I don't know why it's doing that to me, but I can remedy that quite
Call
easily.
your doctor if
Bye.
it has occurred to see if
Shut up, that says. Here's another,
patient.
and I won't go through the whole thing again,
Medication.
but I'm going to show you.
Medication. Instruction. Quantity. Prescription. Use by. Refills remain. Prescriber. New authorized pharmacy. To reorder this prescription number.
So I can go through. So for example, when I'm calling the pharmacy, I can actually quickly jump through and find the prescription number and use it on the phone while I'm talking to them. So it really has made a huge difference. I have to tell you that prior to actually receiving, I ordered the Script Talk device from Envision America. I called them, but they hadn't actually sent the device to me yet. So I got my medication before I got the device. And I was like, oh God, these bottles are exactly the same. The pills look exactly the same. How in the world am I going to figure this out? So I called the pharmacy and I told them my problem. And the guy at New Utrecht Pharmacy, which is in Brooklyn, for those of you from this area, and I'll talk about it more in a moment. I called him and I said, I don't know what to do. He said, well, one is orange and one is white. And I was like, that doesn't really help me. But I have a color detector. So I took my color detector, I put one pill in the little eye of the color detector. It said white. I took that out. I put the other one in the color detector. It said orange, and I was all set. But that was not, I mean, it's much easier to have it tell me what it is. Yeah, so, okay. I'm sending around 2 bottles. One has a lid, one doesn't. But if you feel on the bottom, you'll see there's a sticker, a round sticker. I'd appreciate if you don't take it off, although these are both empty, so it's not an old, so it's not so important. Okay, I wanted to talk about how you can get this kind of information and this device. Envision America is the company that makes the device itself. And actually, we can probably pass this around too. But you'll see on the edge of the device, there is a wheel that you can use. So Envision America, you call them, you tell them where you live. The only place in New York at the moment where you can actually go into the pharmacy and get it, but you don't have to because they do mail order. I live in Manhattan, they're in Brooklyn. I call up, the next day I have my meds.
Are they connected at all with any of these mail order 3-month pharmacies?
No, they are not. It is a private pharmacy, and I have to tell you, if you contact them, which I guess you don't have this information. It's called New Utrecht Pharmacy. It is in Brooklyn, as I mentioned. The information is to contact the owner of the pharmacy. He is a wonderful person. I mean, he's really just been fabulous with me. This device is free. This device is free. Mayor has been really instrumental. He started this before it was even a thought. Somebody apparently told him about it, and he is like way before the rush. the pharmacy number is 718-736-9300. You know, they fill your prescription exactly as your doctor orders it for as many pills as possible, 90-day supply, and they ship it out UPS.
I have a question. This is Rick Fox.
Yes.
Many healthcare plans are pushing people into these big mail-order national companies.
I'll talk about that.
And my company is Express Scripts.
Yeah.
And I would love to be able to tell Express Scripts that I would like this. But I don't know if it's available through them, and I'd like to know.
I'm going to let Kim discuss that when she's up.
The mail order companies. and
Right.
talk about that one.
Because I must say, I also had mail order, and I just switched to the pharmacy. I told them that they provide me accessible information that you can't provide me, and they didn't give me any trouble. So, but Kim will give you a more definitive offer. This organization, for New Utrecht Pharmacy, also does something called dose track. So if you have trouble keeping track of the dosage of your various pills, they can package it in a way that it'll be easy for you to access. Okay, the next place that I'm going to talk about just a little bit is CVS, and you can access them through cvs.com or 888-861-4363. Now, they also have and this is mail order only. You cannot go into a CVS and say, "Hi, I'm here. I want your device for the blind." They don't have it. You really need to go online or call them directly, and they will arrange for you to get the device and to access via mail order the medication you need. Walmart also has a mail order only possibility.
The information about you is in the packet that they gave in the door when you walked in and signed in.
Yeah.
Is there information about the company in the packet?
If you have,
I have a separate handout with all the phone numbers for CVS and everything.
Thank you.
So
except
that-
for New Utrecht, which
Right, which was Ellen's
unfortunate,
pharmacy.
yeah. Anyway, Walmart is also an option for accessible prescriptions using Envision America's device. And you can call them. I know when I've called every one of these places. And when I called them, I discovered that some places are easier to access. CVS was there immediately and knew exactly what I was talking about. Walmart, the woman was a little tentative, but ultimately she understood. She tried to send me to another person, but that didn't work. And then when I sort of explained a little more clearly, she said, "Oh yeah, I know." And I could have contacted them. I mean, obviously I don't need 3 pharmacies.
This is Gene, I have a question.
Yes.
Is speech output the only option?
No. So-
Go ahead.
Okay. There is also a Braille option with Envision America called Scriptability. That's like their full-fledged, they can do a large print option, they can do a Braille option, or a speech option, but the pharmacist has to have that in place. Braille adds some complications, as you can well imagine, in a little neighborhood pharmacy setting. So the Braille option tends to be more, again, back to the mail order options.
So the Braille option is not available in a piece of equipment, but would
Correct,
just
it gets,
be-
it
would
gets
be
affixed
printed
right to the bottle.
Wow.
That's correct, the Braille option gets put right on your bottle.
Just for your information, I do get Braille labels through Express Scripts.
Oh, that's-
But clearly, you know, if they're affixed to the bottle, they're not gonna give you the warning.
That's right.
They're not gonna give you the expiration date. they basically give you the name of the prescription, the RX number, and you know how often you're supposed to take it. That's all that's going to fit on a bottle.
Right.
So, but it's better. I mean, I'm happy to have it.
Good. All right.
The last place that I'm going to talk about is, oops, I have the wrong page. Yes, I do. Is Walgreens. And it's interesting because when you call Envision America to order your device, you cannot, they do not even include Walgreens. However, I called there, and I must say, I'm still waiting to hear. I got a woman, she actually contacted my nearest, well, it turned out Duane Reade, but we all know that Duane Reade is now Walgreens. And she contacted the woman, and I got a call saying they understand that I made a complaint. So I called there, and I called back, and I said, no, you didn't understand. I didn't make a complaint. I'm interested in your prescription labeling options. She didn't know anything about it. This was the pharmacist. She said that she would check with her supervisor and call me back. That was the beginning of the week. I'm still waiting. So.
I'll talk more about that.
Okay. Yep, very good.
Okay. Yes, I was going to wait for
Sure,
Ellen to come back
okay,
this
Alan,
way.
okay, if you want. And our next speaker is Kim Charlson, Director of Perkins Library. Yay! Okay. Over the course of, thank you, Kim, popular lady. Over the course of her career, Kim Charlson, has distinguished herself as recognized national and international expert on library and information services for people with disabilities, Braille literacy, adaptive technology in libraries, and information access. Charlson was appointed director of the Perkins Library in 2001, where she oversees the circulation of more than 500,000 accessible books, newspapers and publications in Braille, large print and digital auto formats. Prior to becoming director, she worked for 16 years as Perkins Service Management Librarian and Assistant Director. Charlson also serves as on a number of committees for the Library of Congress's National Library Service for the Blind and Physically Handicapped, and as a national member of the Braille Authority of North America. She is a member of the Massachusetts Braille Literacy Advisory Council and has served as an appointed member of both the Governor's Advisory Council on Disability Policy and the Secretary of State's Help America Vote Act Advisory Committee. In 2013, she was unanimously elected as the first woman president of the American Council for the Blind. Yay! She is also active in a wide range of consumer advocacy arenas, including arts access and audio description, civil rights, guide dog access issues, and special education. In her local community, she serves as the chair of the Watertown Commission on Disability. Charlson has contributed to numerous publications, including a chapter in Braille, Into the Next Millennium, which was published by the Library of Congress, and Making Theater Accessible, a guide to audio description in the performing arts, published by the Northeastern University Press. Recently, she published Drawing with Your Perkins Brailler. That sounds good. Drawing with Your Perkins Brailler, an instructional book for using Braille to create tactile pictures. Charlson has a master's in library science, summa cum laude from the University of North Texas, where she was honored as the Alumni of the Year in 2006. Welcome. Thank you.
Thank you very
Sure.
much.
Very welcome.
All
Thank
right.
you.
Okay, well, thank you so much. It's a pleasure to come here from cold Boston, snowy Boston. So I'm very happy. We've had a pleasant visit. My colleague, Vicki Vogt, who's here today, works at Perkins with me, and she came along for the conference. So as the bio said, I was elected in 2013 as the president of the American Council of the Blind. And, and one of our major advocacy initiatives is in the area of accessible prescription label information and structured negotiation. So there's a few things, and I'm going to talk a little bit more about the policy and the background behind how we've gotten some of the agreements that we have, and then talk specifically again about the places that provide the accommodations and what those accommodations are, and in a couple cases demonstrate some new equipment that's available to provide access. So ACB's been working on this front for several years. A culmination of one prong of our initiative was a legislative effort to change the law requiring providing access to information. So effective on July 9th, 2012, the legislation was passed and signed into law by President Obama. It was the United States S3187, which was the Food and Drug Administration Safety and Innovation Act. Just for some statistics, more than 21.5 million Americans experience vision loss that renders them unable to read prescription drug labels or other medication information independently. And with this incidence of vision loss expected to increase with the rapid aging of the American population, the consequences of being unable to read prescription information pose significant public health challenges. People who are blind or visually impaired can easily mistake and consume the wrong medication, the incorrect dose, or an expired drug because they are unable to read the label or to distinguish between medication containers. So I thought Ellen's use of the color identifier was very innovative in managing your own health care. So the legislation, section,
Recommended.
I don't think so. So section 903 of this legislation from the FDA Enhancement and Safety Act called for the establishment of a best practices group that included industry, people who are visually impaired, to provide recommendation and guidance to pharmacists on actions they could take to ensure that blind and visually impaired people understand the information on their prescriptions. So the guidelines that the pharmacists were provided and that this committee worked on, and the American Council of the Blind and the Council of Citizens with Low Vision and many other blindness organizations were also part of this best practices. The document, which I'm not giving you a copy of, but I do cite it in my notes, so you don't have to, I'll have Braille and large print notes at the end, so you don't have to take copious notes. There won't be a quiz. But the document itself, which was created under the auspices of the Access Board, is called the Best Practices for Making Prescription Drug Container Label Information Accessible to Persons who are blind or visually impaired or who are elderly. And that was created by the Access Board and released in July of 2013, 1 year after the legislation took effect. So, a provision of the Act, again, authorized the Access Board to convene the working group to determine what kind of features needed to be part of the best practices. So there's a delivery of variety of identifiers producing accessible prescription label containers, container labels, and methods to use. Obviously, there's hard copy Braille or large print. There's digital voice or text to speech recorder. There's RFID, which is what the script talk system we passed around is based on, with that RFID sticker on the bottom. So the process that the American Council of the Blind has used to successfully to get companies to provide accessible prescription information is a process called structured negotiation. So it is a process that involves lawyers, which is not always a bad thing. But it's not a litigious adversarial process. Structured negotiation is a process where both sides basically recognize that there's a problem and agree to come up with a solution and to negotiate a settlement that will be mutually beneficial to both sides. So instead of spending hundreds of thousands of dollars in court fighting back and forth, we identified this is a problem. You know, if we use structured negotiation, your company can do something that is very good. You can make this work for people who are blind. It will be very advantageous to you to have a positive outcome rather than to fight that you don't want to do this. So ACB over the last several years has worked with several pharmacy chains in the United States to offer accessible prescription information. So the 3 agreements that ACB has been involved with include Walmart, Walgreens, and then CVS Health with CVS.com, and CVS Caremark, which is a division of CVS Health. On 2 of the 3, we were supported by the American Foundation for the Blind, as well as specific affiliates of the American Council of the Blind, the California Council, the Bay State Council, the Illinois Council of the Blind. Primarily because those corporations had, their headquarters were in those given states, or the states themselves have very strong access laws requiring the provision of accessible information. So I want to tell you a little bit about the 3 settlements and then also demonstrate a few other devices that are out there for you to use when accessing prescription information. So the first one, Ellen referred to, one of them was Walmart. And Walmart does offer the script talk option through their mail order service. And I'll provide you with the phone number for that. And again, the process, just to give you a little background, because the pharmacist is very important in this process. So the Envision America Script Talk device is provided to a blind consumer free of charge. The pharmacist or pharmacy or mail order division of a pharmacy purchases a kit that generally is like a USB drive or a docking station with some software on it, and then and some labeling supplies like the RFID stickers. And so the docking station and the device to create the tag or the RFID sticker is what the pharmacists use. They key in information into their computer that makes the labels for everybody's prescription. And they generate, of course, they generate the print label just like they would for anyone. And then they create the RFID tag using either some systems and some solutions use human narration, the narrator records it themselves, or a text-to-speech option, which is probably preferred because sometimes when you get human intervention involved, you can get unusual words. I guess text-to-speech can do unusual words too, but at least whatever was put into the system is what comes out. And the one thing that Walmart is doing now that few people seem to know about is that if there is a Walmart pharmacy near you, you can request through Envision America to have that pharmacy equipped with the script talk system that the pharmacists use. And then you can use the Walmart pharmacy and get accessible prescription labels with the script talk system right in your own community. So that's done on a case-by-case basis. It's not, a global agreement that right now every Walmart pharmacy has the ability to do it. But if you request it, within 30 days, basically, they will have a setup in place so that they can do it if you want to purchase your prescriptions from a Walmart pharmacy. So that's a new angle on what Walmart is providing. The CVS.com settlement from last year with ACB was, again, a script talk solution for the audio output. And the most recent agreement that ACB negotiated was CVS Caremark, and that was done just this past January, so it's been about 3 months. So CVS Caremark, I've been purchasing medications from them for several years with what I call a pretty robust system they have for providing Braille labels on your prescription bottles already. They've added the script talk so that they can provide the audio identification as well. And when you order any product with the Braille, certainly you get a Braille patient information sheet, which is in Braille usually many sheets, that tells you all the little facts and warnings and that kind of thing about the medication. So it's the same little slip of paper that's all folded up in your bag when you get your prescription and you never pay any attention to it because you can't read it. That's what's provided by CVS Caremark in Braille. Question?
Yeah.
Uh-huh.
Is there an option for them to simply email it to somebody, that information, and then I would have it on my device and say I was deafblind, I could read it on my Braille?
I don't know, but I think that's a really good question to ask. I think there might be, and I haven't availed myself of it, but I'll certainly follow up on that and see as well. Yeah. So, and again, that settlement was with CVS Caremark, and a lot of government retirees use CVS Caremark. I heard Express Scripts talked about, and I know we've done some work with Express Scripts, but not since I've been in the leadership of ACB, which would be over the last 5 years. So I'm going to have to go back and do a little research on what the provisions are for Express Script. But I know that we do have some accessibility work that we've done with them. So Walgreens, our settlement with Walgreens has been in effect for about 9 months. Well, actually, yes, it was in June of 2014. So Walgreens took a very different approach to providing accessible information for people who are blind. And they created their own system for doing that called the Talking Pill Reminder. So the Talking Pill Reminder is a round disc about 3/4 of an inch thick. It's about the size of an average cap on a prescription bottle. And it is a talking device with adhesive on one side, and then the device with 2 buttons on the top. So there's the mic. I'm going to see about demoing this. Let's see what happens. Well, I think what happened was that I pushed the record button sometime during my travels. So let's see. Is this a test? Because I did have something on here. Yeah, then it spoke. Let's try the other button. So one button, which, again, my demo is probably indicative of some of the issues we're having with the Talking Pill Reminder. So I'm holding. Okay, it said it was recording, and then, yeah. So the talking pill reminder, Walgreens created their own solution, and they provide this device free of charge to any blind or visually impaired customer who is filling their prescriptions at a Walgreens pharmacy, theoretically anywhere in the country. We've had some issues with the rollout because they have over 8,000 pharmacy locations across the country. They are the largest pharmacy chain, and Duane Reade is part of that chain. And it's very challenging for a big company to get the word out down to the local pharmacy level. And so we've had some issues about stores not being aware of the talking pill reminder, stores saying that you could have one, which is kind of silly. If you have 4 prescriptions, you need 4 of them. So other stores have been very good. Some stores have provided, 4 talking pill reminders, but they just drop them in the bag. Like, here you go, here's your 4 pill reminders, and they didn't record anything on them. And the other thing that probably I've heard the most, and I'm going to pass this device around shortly, is there's an adhesive on the bottom. You peel off, and then there's a sticky adhesive that you stick it to the top of your prescription. So a lot of folks have said the adhesive isn't strong enough because what do you do when you want to take a pill? You twist the lid. So if you twist the lid with the talking pill reminder on the top, you're likely going to twist the talking pill reminder right off the lid and have to reattach it, or you might drop it. One of my staff actually dropped theirs and it rolled under the bed, and she still hasn't gotten it out from under the bed yet. So I hope she knows which pill bottle it came off of, because I'm going to go ahead and pass this around. I give Vicki. Jane, thank you. Thank you. Okay. I give Walgreens, high marks for coming up with a solution that could be a community-based solution, because I know how much we all want to have kind of across-the-board accessibility when we go into a place to be able to get this. The concept was very good. I think perhaps the implementation might have, benefited from a little more planning. But if you have a problem with your local Walgreens and you don't have a positive experience, they don't know what the talking pill reminder is, you can call their customer service number, which will be on my handout, and just say, you were trying to get the talking pill reminder from Walgreens, your local area Walgreens, and they'll ask where that is. And they're very good about communicating back to the staff to make sure they're aware of what the options are. And again, it's free to Walgreens customers who are blind or visually impaired. Now, the chain has also been selling them on the retail floor for $9.99. So some folks have encountered going to the pharmacy to fill their prescription and then being told they needed to pay $9.99 because the staff knew there was a product out there on the floor that was being charged $9.99. So it's free if you fill a prescription. If you just want to go buy one because you think I'd like to use it on my other prescription that I have from someplace else, $9.99, you can buy one. So.
Kim, this is Rick Fox. What I don't understand about the pill reminder is how it works. Does
the process?
Yeah. How does it? What is it?
Okay. So have you seen it yet?
Yes.
Okay.
I've seen it, but I don't know what it's.
Okay. So it has 2 buttons, one with 1 dot, one with 2 dots. And one button, I think it's the 1 dot button, is the record play button. So you push the button and hold it down for, X seconds, and that will trigger the recording, and then you push it again to stop. So the recording is supposed to be done by the pharmacist. They are supposed to record what your prescription label says, and then affix it to the bottle. The other button is a timer button that if you push it, it'll set for 2-hour increments. I haven't found it particularly friendly. It's very hard to stop it. So please don't push the timer button, because then I'll have a beeping device on the train when I go home tonight, and they're going to be really suspicious of me. So it's gonna.
Like for every 6 hours, right?
Oh, well, that's better than every 2 hours, so that's good. So that's how the product works.
But after the 2 hours is up, it doesn't erase it, you have to, get rid of it? If you used up all the recording time?
It only has 30 seconds of recording time. So for the pharmacist, he has to talk pretty fast, because that's all that it has is 30 seconds. And that, in my view, is not enough time. So the timer will keep going. I mean, the timer will just keep going off every 6 hours and give you an audio alarm. So there is another product on the market that's been out for about a year, and I'm quite impressed with it. It's called the digital, let me see, it's from Accessimed, and Accessimed has, I'm looking for the name of it, drug labeling solution. I tell you all about Accessimed in my handout. I think it's the digital prescription label or something like that. So, and it has a button on it.
Hello, I am the Accessimed digital audio label. Did you know that more than 21 million people are living with vision loss and are unable to safely and independently take their medication? We have provided a solution to help. With
So,
the push of my button,
I have
relay all
two
of the
bottles
information
on the
on
desk,
the
Jane,
label.
in front where I was
From
sitting. You
patient
can pass
name
those
to
around.
medication details and warnings, I allow up to 60 seconds of information. I am prepared by the pharmacist with our proprietary text-to-speech software. The pharmacist then permanently applies me to any prescription. Be safe. Be independent. Visit our website for more information at www.accessimed.com.
So that has 60 seconds, which is a lot more time. The speech is very clear, and it affixes to the side of the bottle and has a very, very strong adhesive. So when you attach this to the side of the prescription bottle, it's not going to pop off. I've tried, I'm sure somebody could, really, really work at it, but it does not come off easy like the talking pill reminder does. So,
You have George Washington's medical marijuana.
yes. So,
And the pharmacies that carry that?
well, Accessimed, again, it's similar to the Script Talk solution. The pharmacist can, for as little as $250, the pharmacist can get a whole kit with including the software for the text-to-speech voice, and can record and make the labels that affix to the side of the bottle. So it's a more affordable solution for a pharmacist. I don't know what pharmacists have to pay to get the Script Talk system. I know they pay something. It's probably $400 or $500 would be my guess. So, but the accessibility on our end as a consumer is free of charge. So these labels are purchased. They're about $3 for one of these little Accessimed labels. So,
So that the customer would pay the $3?
no. No, the pharmacy, right, the pharmacy would buy a supply of these labels and have them on hand.
And then the software is $250, you said?
Yes, for the pharmacist, the startup kit, so that the pharmacist has all the tools they need to create the label.
Walmart and
So this is Accessimed, and this is new, but Walmart is using ScriptTalk. Walmart is using ScriptTalk, CVS.com and CVS Caremark are using ScriptTalk. And we have some other negotiations going on with some other pharmacy chains that will probably be using one of these options that I've talked about today. Yes?
Can you explain how the Walgreens one works? You put a bottle underneath? Or
You peel off, the bottom has a sticky adhesive label that I haven't peeled it away because then it would get all grungy, so I have left it on with the protection on it. But you peel away the adhesive and you have a sticky label that you stick to the top of your Walgreens pharmacy medication. So it goes on the lid. Yeah. So the one from Accessimed, obviously you can tell it's on the side of the bottle. It stays on much better. You don't have the problems of it popping off when you twist the cap. And the speech is a lot more clear. A longer message also, that's right.
My question is, with the council, are they gonna try to do mail-in pharmacies? So, people like do a 3-month supply?
Yeah, that's what, like CVS Caremark is a mail order.
I have Aetna.
Aetna?
Yeah.
I don't think we've done anything with Aetna yet, but there's something RX. Let's see.
RX home delivery?
Oh, it might be, maybe it's here on my, I'm looking for it to see if I wrote about, yeah, I think I did. Let's see.
Aetna RX home delivery?
Oh, it's Optum RX, which is the mail order pharmacy for United Health. So a lot of people have United Health as their healthcare provider. Some have Humana. We're working with Cigna, we're working with Humana right now to try to get them to do exactly the same thing that CVS Caremark has done and Express Scripts has done, at least with Braille so far. So there's several things in the works that are.
Kim, I want to let you know that as far as I know, with Express Scripts, they do not provide a Braille fact sheet.
Correct.
That would be, to me, that is essential.
Yeah, I think so too.
So if you re-establish negotiations with them, it would be
Yeah.
very important to get a fact sheet with all the information that's on that little piece of paper.
Exactly. And one of the companies that we're negotiating with right now, they're going to provide Braille, and they have a 24-hour hotline that is always staffed by a pharmacist. And so they believe that is more effective for communication for somebody who can't read Braille, is to call and the pharmacist will read it to you if that's what you want him to do. We said, are you sure you want that? You want your pharmacist to be reading stories to blind people about their prescription drugs? And they said yes. So sometimes it's interesting what they feel is an appropriate accommodation and what we feel is an appropriate accommodation. Because I think in most cases, I would opt for something that you can reread yourself without having to engage a pharmacist at the other end of the phone as a preferred way of getting that information. So,
Also, since everybody, a lot of people have computers with email.
yes, an email is an option. Yes, and we're seeing more of email as a settlement option to get your prescription information via email. Yeah. Questions?
Yeah, anybody, questions now?
And
2 minutes?
Vicki, if you could start to pass out the handouts, that would be great.
Raise your hand if you want Braille.
The only thing I had to say about
I think I have 8 or 9 Braille, so if we have more people, you can take the one I just used for my speech as the last one. Sorry, go ahead.
Kim, it surprises me that this isn't covered under the ADA, because the ADA requires that a company provides its goods and services.
Uh-huh,
And what is a prescription but a goods and service?
that's right.
So
That's
it
right.
surprises me that we've had to go through all of this.
Yeah, that we had to go through federal legislation and then a rulemaking process to create the backbone for the process that we're now using. And unfortunately, it still isn't as streamlined as I'd like because it's requiring us to have agreements with each and every company. And that's kind of the hard way to do accessibility, but for right now, it's what's working.
Let me just say that the United Healthcare, that's the service that I had, Ultima, and they didn't give me any trouble when I switched to the pharmacy in Brooklyn.
Yeah, the OptumRx service with United Healthcare, yeah, yeah. Any other questions?
May I have a large print as well to give to colleagues?
So,
I have a question.
uh-huh,
Most, some of my medication comes, they put it in, like my eye medication, they put it in a box.
yes.
Is there a system for reading labels on boxes rather than round bottles?
You know, I was talking to somebody this morning about eye drops, especially because they're small.
Right.
So, yeah. So I usually they label the box. Sometimes I get mine and they put the label on a Ziploc bag, and then they put the medicine in the Ziploc bag. So all you can do, and that's using Braille labels as my preferred medium. You can put one word on a bottle. It's like, so sometimes I put the name and the number of drops you're supposed to do 4 times a day. I'll just put a 4 or a 2 or a 1 if I label it myself. But the professionally done labels I've received are generally putting it on a Ziploc bag and then putting the box inside the Ziploc. Uh-huh.
Yeah, I just want to say I get 2 different kinds of eye drops. Usually the one with the Ziploc bag is refrigerated. And
Ah.
also they have different lid boxes. One I have is a little perforated, and the other one is in the Ziploc bag is not perforated.
Yeah.
And the bottles, sometimes, a lot of times, they're a little different sizes. Instead of 3 ounces, they might be 4 ounces.
Right.
So there's ways they can.
There are several ways, and sometimes they put eye drops in basically a pill bottle, which gives you a little more area to have a Braille label, or to use the Script Talk that way. So I think that's how Script Talk would handle it. They'd put an RFID tag on that bigger bottle, and you put your eye drop in that bottle.
Okay, I think that's it.
All right?
3 people that need Braille still.
3 people that still need Braille. Well, here's one. They can fight over it. I even made extras, you guys. So,
Thank you very much.
and if you didn't get one and you have email, I'd be happy to take your email down, and I can send it when I get back to my computer.
Well, thank you very much.
Thank you very much.
Thank